Hello, my name is Bridale Robinson. By trade, I'm a registered respiratory therapist. I currently work as a clinical coordinator for the respiratory care department at Northwestern Medicine in downtown Chicago. So my role as a respiratory therapist in adult critical care is such an integral role. It's so important because we're working with patients not only from their admission, but we're working with patients all the way to their possible discharge, whether it be working with patients in the ER, in the ICU. We're also involved in their care and ending their lives as well. So we're kind of there from the beginning to the end and everywhere in between when it comes to working with patients in adult critical care, because we do so much for them outside of just treating their diagnosis. We're also there at the bedside, comforting them and comforting their families, and working with the interdisciplinary team. I wanted to work with critically ill patients because I like the fast-paced environment. I like the critical thinking skills that you have to develop. You're always using your brain while working in critical care, as well as I feel that you really can immediately see the difference that you make in a patient's life. The turnaround time on that sometimes is very quickly, whether you're working in maybe the cardiothoracic ICU and you're admitting patients after their heart surgeries, or you're working in the neuro ICU and you're working with patients on exercising their lungs and getting some better lung function. It's really a rewarding experience working in critical care. It can be very, very stressful. It does have the stress side, but it's knowing what to do with the stress. Balancing self-care and being an RT comes down to knowing when to turn it off and knowing that it's much better for you to not take things home. Therefore, when you go to sleep, you rest, you wake up, you're fully recharged to 100%, and you're willing to give your all the very, very, very next day. It's also finding and forging good relationships with colleagues and interdisciplinary staff. That makes work much nicer. It makes work go much smoother, as well as finding outlets, whether that be meditation. I like to do meditation. I like to ride my bike. I like to do home workouts. There's so many things you can do to kind of get that excess energy and the excess thoughts you may be having just out, just get it out. Job security in respiratory therapy is solid as a rock. You can't go wrong. There will always be something for you to do, somewhere for you to work, as well as things that may appeal to different people. If you want to work in a pulmonary function lab, you can work in a pulmonary function lab. If you want to work in adult critical care, you can work at a research institution. You can work in hyperbaric oxygen. You can work on a transport team. You can work with children. You can work in pulmonary rehab. There's so many different opportunities for those going into respiratory therapy. It's not just, there's not just one place for you to work. There's so many different places you can go, in places that you can help you grow and appeal to your interests. How I feel I'm making the difference in the lives of patients is not by only caring for them and helping them to achieve better health through different devices and therapies that I have in my toolbox, but it's also by being a caring and a compassionate individual and giving my best effort to every single person that I come in contact with and treating them as if they were my own family. Respiratory therapists are vital to the healthcare system because of how transformative we are and how, once again, flexible, keyword flexible we are. We're seen everywhere. We can be an outpatient, we can be an inpatient, and we always have great ideas and we always bring something to the team. We bring a very specialized perspective that not many other providers have because of the education that we received. And I think that if you go to a place and you don't see a respiratory therapist, I would be very, very, very surprised. Advice I would give someone that's younger looking into health professions, especially respiratory care, would be work on your flexibility and your patience, because many things that you want will not happen right when you want them to happen. But having, just a strong sense of self-being and self-worth, that things will always come to fruition if you're working towards a degree or you're working towards, helping others. I think just being very self-aware is going to be really, really important. And just know that working in critical care requires a lot of flexibility from you as a person, because there's going to be many situations where there's going to be 3 people paging you and 1 person calling you all at the same time. And it's just knowing how to prioritize and always just keep your cool. If you're looking into any allied health professions, respiratory therapy would definitely be a great contender. Respiratory therapists are known for being so well versed in what they do, bringing so much to the table, being great team players, and providing some of the best care to patients that I've ever seen and that I've ever felt. You can't go wrong. Can't go wrong.